Hello and welcome back to our discussion. So in this session, we are going to look at the treatment of peptic ulcer disease. And in the treatment of peptic ulcer disease, we are going to look at it in three different ways. So we are going to look at the supportive treatment, medical treatment, and surgical treatment. So let us start with the supportive treatment. When we talk of supportive treatment, these are the things that we are supposed to do once we have been diagnosed with PUD. So the first thing is what we call medical or drug compliance. So once you are diagnosed with PUD, the doctor will prescribe some drugs that you will be using. So it's advised that you use those drugs according to or the way they have been prescribed to you. Don't just assume, skip some or skip some days because that will not help you. So kindly, it's advised that you use the drugs the way they have been prescribed till you finish them. The other thing is that it's advised that you be taking small frequent meals every day, and that will help you a lot. The other thing is that you're supposed to find emotional support, be it from the family, friends, or elsewhere. Emotional support is very important. The other thing is you are also advised to avoid things like alcohol. Remember, we have talked about it. You are also supposed to avoid things like smoking. Check on the diet that you are eating. Remember, we said that spicy food can lead to PUD. So check on your diet. Avoid spicy foods. You are also advised to avoid drugs that can cause irritation to the mucosa. Drugs like NSAIDs, remember we have seen them earlier. So you are advised to avoid them. So that is the supportive management. And now let us look at the medical treatment. So in the medical treatment, once you have been diagnosed with peptic ulcer disease, the doctor will prescribe to you what we call triple therapy. And in the triple therapy, we normally give 2 antibiotics plus 1 proton pump inhibitor. And this combination has to be taken for 7 to 14 days. Then you continue with the proton pump inhibitor for the next 4 weeks. That makes a total of 6 weeks of proton pump inhibitor. And examples of, just giving example of this combination or this triple therapy, you can give clarithromycin plus amoxicillin plus 1 proton pump inhibitor like the omeprazole. Or you can also give clarithromycin plus metronidazole plus 1 proton pump inhibitor. Alternatively, you can also give what we call combination kit. Examples, we have the ESO kit, the H. pylori kit, among others. But there are cases whereby you'll be required to give what we call quadruple therapy. And these are the cases whereby eradication has failed with triple therapy. So you're going to give the triple therapy plus what we call bismuth. So that is the medical treatment of peptic ulcer disease. Now let us look at the surgical treatment. So what you have to know is that peptic ulcer disease can sometimes complicate other conditions. And in surgical treatment, there are those things that you are going to consider in order to say that this patient needs surgery in this condition. So there are what we call indication for surgery. The first one is perforation. You'll find that the condition or the PUD has complicated to some perforation. So in such cases, surgical treatment is needed. Other indications are things like obstruction. Sometimes you'll find that there's still bleeding while you are giving the medical treatment. You'll find we have what we call refractory diseases. Other indications includes severe gastric atrophy. You can also have other indications like severe hemorrhages, and you can also have another indication can also be non-compliance to drugs. Remember, we have said that there are those that will not comply. So if you find this patient is not complying to the drugs that he has been given, most of the time will lead to complications, and that will call for a surgery. So in the surgery, you can consider what we call phagotomy, among others. So that is the end of our today's discussion on the treatment of peptic ulcer disease, and it also marks the end of the discussion on peptic ulcer disease. So up to this point, it's my hope that you have learned something and you're going also to educate others out there. And before I wind up, I would also like to request those of you that have not yet subscribed or it's your first time to be in this channel, kindly subscribe, like, share, and comment our videos. And those of you that have subscribed, kindly keep sharing so that we can reach a bigger number out there, so that people may get helped in one way or the other. So, thank you for watching, guys, and have a blessed evening, and may God bless you all. Thank you.